Hello, this is Health and Wellbeing, and I am Lois Apasambu. Physiotherapy helps in restoring, maintaining our function and well-being. And even though there is a general perception that physiotherapy is only for treatment, we can also use physiotherapy for keeping fit. Today, we will be discussing staying fit through physiotherapy. And our guest today is physiotherapist Rahmat Ibrahim, who is the clinical director at My Physio and Eye Clinics. You're welcome to the program.
Thank you. Good afternoon.
And it's nice having you here.
Same here.
So going straight to our discussion, when we talk about, like I said earlier, when we talk about physiotherapy, the first thing that comes to mind is someone has a broken leg or someone had an accident and he has a fracture or one thing or the other, and something has to be done, and that thing is called physiotherapy. But I'd like you to give us in details what physiotherapy is.
Okay, so physiotherapy is a healthcare profession. It's a rehabilitative healthcare that has to do with maintaining, restoring, and promoting well-being. So physiotherapy is a course studied in the College of Health Sciences in the university. It's a degree program, and it is in the College of Health Science. That means it's a rehabilitative medicine, right? So physiotherapy is about reducing pain or alleviating pain and then restoring function, restoring movement. So when you talk about pain, muscle and joint pain, and then when you talk about loss of function, which could be maybe loss of movements, loss of one hand, or stiffness of a joint, you think about physiotherapy. So physiotherapy goes beyond just treating as well. We also do preventive physiotherapy. In preventive physiotherapy, you can talk about educating on sitting posture, standing posture, lifting techniques so as to prevent musculoskeletal disease from even setting in the first place. And when you're talking about fitness, there is an aspect of physiotherapy which we call exercise therapy. So because as physiotherapists, we study the science of pain, we study the science of muscle and nerve function. We study the science of the whole body. So we are able to prescribe the best form of exercise for each individual, rather than just walking into a gym and doing what everybody does. And sometimes you end up injuring yourself, and then you now have to go for physiotherapy. But you have to prevent. You can prevent that, yes, if you have idea of physiotherapy, or you have knowledge of physiotherapy, or you consult your physiotherapist before you even register for an exercise program.
So now let's talk about preventative physiotherapy. Tell us about that.
Preventative physiotherapy is all about preventing injury and pain. Of course, some injuries cannot be prevented. Let's say some sustained from road traffic accidents, from home accident, that may not be prevented. But when we talk about, for instance, work-related musculoskeletal injury, the kind of chair you use to sit at work, your chair in relation to your table, your position of your computer, using a laptop computer in the office instead of using a desktop computer, sitting in a stooped posture instead of being upright. In fact, sitting on a chair where you cannot rest your back, right? Those are the areas where preventative physiotherapists come in. So for instance, we go into our office sometimes to assess a patient's office workstation. Let's say someone has back pain and you're trying to treat that person. If you don't address the root cause, if he comes for treatment and then he still goes back to that workstation with a bad work exactly. So you go there, you assess the chair in relation to the table, and then you assess the computer the person is using. If it has to do with writing, teaching, sitting, you assess all those postures, and then you advise on what is the best thing to do. That's preventative physiotherapy. So it's all about education on what to do. Let's take, for instance, now, most people don't know the right way to bend. Like the way ladies bend, your knee down and then you bend your back a little. It looks like fashion, ladies thing. So by the time a man walks and then you tell him this is the right way to bend, they tell you, I thought it's ladies thing. But in reality, that's the best way to bend so that you don't have a direct gravity acting on your back. So you don't injure your back by just bending straight down. When it comes to lifting, you're not supposed to lift any heavy object for any reason, right? But some people don't know.
For exercise and for muscles, is that exceptional?
No. For exercise, there are lifting techniques for that, and you have what you want to achieve. For instance, you want to build your muscles of your hands, right, which we call the upper limbs. So you know what you are carrying, you are sitting down to carry the weight.
Oh,
do you understand?
okay.
Now, if you're maybe trying to build the muscles of your legs, right, you're probably lying down to carry the weight. And then let's say you're trying to do the one in standing, there is proper way to bend, lift, and then stand up. Do you understand?
Yeah.
So a physiotherapist, that's why I said, even for an effective gym, there should be a physiotherapist on the standby to guide people on how to do the exercise in the correct manner so as to avoid injury from setting in. So that's preventive physiotherapy.
So let me take you back a little to something you
Okay.
said. You said a workstation, a person's workstation,
Yes.
the distance between his chair and his desk,
Yes.
sort of using a laptop. Why is using a laptop wrong?
Okay. It's not like using a laptop is totally wrong, but when you sit at your workstation, right, your shoulder is supposed to be rested. Your hand is supposed to be rested. You're not supposed to be elevated your shoulder is not supposed to be elevated in any way or depressed in any way, right? Your wrist when you are typing is not supposed to be either up or down. It's supposed to be straight. Do you understand?
Okay.
And then the screen of your system,
Yeah.
of your computer, is supposed to be at your eye level. So by the time you access most laptop at times, unless there's a support, right, you realize that you have to bend most
Down.
times to work. But by the time you use a desktop, because it usually have an elevation, you are able to set it in a way that you're looking at it at eye level. So you're not neither bending your neck forward or backwards to prevent neck pain or shoulder pain, right? And when you talk about a distance of your chair to your table, if your chair is not close to your table enough, you're most likely going to bend forward,
Yeah.
right? And that's injuring your back in the long run. Do you understand? So that's why that's important.
Okay, so there's this thing of people complain like when they sleep on, taking it back, orthopedic beds.
Yeah.
They say they are good for us. But some people say they sleep, they sleep on orthopedic beds and then they begin to have back pain.
Okay.
So what's the reason behind that? And there's some people say when they sleep on normal beds, that like the foams are kind of slopey, they have back pain. So you wonder what's the disparity and why?
Okay. So there is no one rule for all. What works for A may not work for B. Now, talking about back pain, because that's actually the culprit most times,
Yes.
the cause of back pain differ. Do you understand? We may have the same symptom, but the cause may be different.
Yeah.
So you don't just go for an orthopedic bed because you think my friend is in an orthopedic bed and it's good for my friend, right? So you go for orthopedic bed on prescription, right? Orthopedic beds are strong, hard. It may be too hard for some people's body, and then it has to be after you've been assessed, and then your need is being considered. Then that can be prescribed for you. Otherwise, probably you're using a spring bed. But the most important thing is that you don't use a bed that dips in once you sit on it or lie on it. Like you lie on your bed and your bed just goes in. And by the time you stand up, it takes a while
To come up.
to come up. That's not good enough, right? Because it's going to deform the shape of your body. The most important thing is to maintain the natural curvature of the spine of the body in whatever position you are, whether sitting or lying position or standing position. So if you have a bed that you have to, somehow corner and all that,
Yeah.
it may injure your back. So it still comes down to prescription.
Well, there's still more I would like us to talk about because,
Okay.
like you said earlier, back pain is most time the culprit,
Yes.
and so many people don't even know how to go about handling this. It's either, okay, my back is paining me, I should just take some painkillers, or people rarely go to the doctors, people rarely go to the physiotherapist to check something is wrong, what should I do? But we're going to discuss this when we come back from this short break. So we're going on a break right now, and when we return, our discussion will continue. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803 705 1784, or Dr. Doris John, 0803 315 6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Thank you for staying with us. This is still Health and Wellbeing on ASO Television. And before we went on the break, I and physiotherapist Ramat have been discussing physiotherapy and how we can actually take care of ourselves, most especially as it relates to our bones and our general body as normally. So before we went on the break, I said we're going to talk about our back pain, most especially. Yeah. What should you do if you find out that at a point you are having back pain? Okay. What should be the first thing you should do?
Okay. So most people, about 85% of people are going to experience back pain at a point in their life. It's very, very common. So when you have back pain, right, it could be as a result of so many things, but I'd like to start from the baseline. First thing I advise is you analyze yourself, right? Because if you go to see a physiotherapist, you are going to be asked a number of questions. So unless you have answer to those questions, you may not help us to reach diagnosis. So it's important to sit down and analyze how you have used your day, or probably how you've used your week, what you have done. Have you stressed yourself, right? Have you been hydrating well? Have you been eating well? Have you been having enough rest? Have you been taking enough fruit, right? So first thing when you have back pain is rest. That's the first thing. Rest. Just rest. And then take a lot of water. Hydrate yourself, right? So when you, instead of just going for drugs immediately, right, what drugs does is to help relieve the inflammation. But then when you rest, you allow your body's natural system to heal you, right? Now, if your back pain persists for like 2-3 days or is so severe, then you can see your physiotherapist and get assessed, right? But the most important thing is make sure you rest and to make sure you take enough water to help detoxify your system. Then after that, you can go and see your physiotherapist. When you see a physiotherapist and you're being assessed, the course is going to be narrowed down, and they will definitely tell you whether you need physiotherapy treatment sessions or what you just need is probably to take over-the-counter drugs or probably more rest, and then you're fine. Because we don't like rushing into, go and take drugs, go and take that, right? Natural living, it's very, very important, and we emphasize that a whole lot.
So at what point because in my mind, I would think that it is when your situation is critical that you would be prescribed drugs. Is it that way?
No. Physiotherapists hardly prescribe drugs. The most beautiful thing about physiotherapy is that we try to wean you off drugs. We do our best to wean you off drugs, to make sure you're not used to taking drugs. You're not taking drugs chronically. You see some people, they have pain. It could be knee pain, back pain, any form of pain, and then they've probably been on drug for like 6 months. They've taken different types of painkillers, anti-inflammatory drugs, and all that. So what we do as physiotherapists is to treat you. We use physical means, and we work with our hands a lot. So to wean you off those painkillers so that you are not dependent on drug. So unlike what you think that is when it's severe that people go for drug, in the reality people go for drug so fast at the snap, yes, at the easiest thing, but that is not encouraged at all. Like it doesn't have to be so bad for you to see a physiotherapist, and you don't even have to get sick before you see a physiotherapist. Just like you do your normal annual medical checkup, you go for lab tests, x-ray and all that. It's important to go for physiotherapy checkup where your back, your joints, your muscles are going to be assessed. That way, you can even prevent injury, degeneration from setting in than going after it has already set in. So physiotherapy checkup is highly encouraged.
Now let's talk about physiotherapy and keeping fit.
Okay.
How do you keep fit with physiotherapy?
With physiotherapy, exercise is like the most important aspect of our treatment. So as a physiotherapist, exercise is a part of you, right? But then, individual strengths is being assessed, right? What you need will be different than what I need. And then we'll call something graded exercises. Like before you start exercising, you're supposed to be assessed on what level is best fit for you. So you don't develop any injury while you start exercising, and then you increase the range of exercise. So there are a lot of exercises to do. We call some resistant exercise where you use weights like dumbbells, like sandbags. Then we call something Pilates exercise. It's a form of rhythmic exercise that involves breathing, posture, balancing, body awareness. We have yoga, we have Zumba, we have different forms of exercise, but most importantly as physiotherapists, we assess you, we know your need to know as in what's the best exercise. For instance, most people want to lose weight, but in reality some people want to gain weight. Right,
Yes.
and then exercise can be used to gain weight as well, as much as it can be used to lose weight.
How do you do that?
So, so it all depends on your needs, right? For when someone wants to lose weight, we'll be working on exercising when he's hungry, exercising and not eating, watching what you eat and all that. Someone who is trying to gain weight will do more of resistance exercise, weight training, and eating more protein, and make sure you're eating well, and eat after exercises because you're not trying to lose weight.
I really want you to hear more of that. How do you exercise to gain weight?
To gain weight, yes. You eat a lot of
that?
protein, right? You eat carbohydrates as well, right? And then you don't starve yourself at all. And then you don't exercise when your stomach is empty.
Oh.
Do you understand,
Okay.
right? And then right after your exercise, you go for your food. Right?
Oh.
So what you're trying to do is that as you're eating well, you're probably on some multivitamins and all that. You're trying to make sure that the weight you're gaining is not fat, it's more of muscles. And then you're building your bones as well. So whatever weight you're going to gain is going to be a healthy weight, not a fatty weight. Unlike when you're just eating that I want to gain weight, I want to be fat, let me just eat and sleep, eat and sleep, eat and sleep. That way, you're most likely going to gain a fatty weight, right? But then by the time you eat well, like really well, a lot of protein helps in building muscles, a lot of protein, and then you eat carbohydrates as well, which gives you a lot of energy, right? And then you exercise more of resistant exercise where you carry weights to really build those muscles, then you are most likely going to gain weight.
But we also carry weight when we want to lose.
Of course.
As well. So it depends on how we eat. So now this
Yes.
translates to our diet.
Our diet,
so it's
yes.
more on our diets than on the exercising.
Our diets, right, and then the intensity of the exercises as well.
Oh.
How much you do the exercise as well, and then what time of the day you do the exercise.
No.
Yes.
Okay, so for losing weight, you exercise in the morning. For to add weight, you exercise at night, or how does it work?
For losing weight, in the morning, of course, your stomach is empty.
Yeah.
So you just take water. I'm an advocate of water intake because water is life. So you take your water and then you exercise, right? Give it some time, you take your fruits and that. Of course, your individual is going to be assessed because there are a lot of health factors that have to be considered before you're being prescribed that. So nutrition therapy comes in as well. But in case where you want to gain weight, you must have to take your tea early in the morning or probably your cereal, and then you go for your exercise, right? Because you're not trying to burn fats. Okay, so I'll probably take your fruits, your water, and then you go and do your exercise, and you come back and eat immediately. So,
okay, so I get it now. We're clear on that.
Okay.
So basically, people that actually want to lose weight as well can actually do this kind of exercises, just like you said, but on empty stomachs. So just to get it clear and to
Yes, on empty stomach, yes. But like I said, health factor is important. For someone who has ulcer and all that, those things have to be considered before you prescribe. That's why I said it's individual based.
Yeah.
So it's better to go for assessment. Let all your health conditions be considered, right? Let's say the person has diabetes and is trying to lose weight. The person has ulcer and is trying to lose. Those are peculiar conditions that you have to ask them about their symptoms, all around their symptoms, to design the best form of exercise for them and then what time to exercise. So there's no general rule
for everyone. Well,
Yes.
now taking it back a little bit to workplaces, and I believe there are little exercises that you could do, because over time we heard that it's not good that you stay in one place for so long. You have to move and all of that. What kinds of exercise for people that actually spend hours at work? What kind of exercises that can they do that doesn't necessarily, is not very time consuming and cumbersome, but just to make sure that they're fit?
Okay. At work, you have to make sure
Yes.
that you're not sitting for more than 2 hours, no matter what happens.
Okay.
You have to take break. You have to stand up and do something. Take break of like 10 to 15 minutes. Do something, not more than 2 hours. At the same time, you're not supposed to stand for more than 2 hours. So in fact, if you can do less than 2 hours, it's perfect. It's good. So that time, you use it to probably walk a bus, probably pick up a file, probably go to talk to a colleague and work stuff and all that, probably go to use the restroom, probably go to eat or something, but just take a break after every 2 hours or less than 2 hours, right? And then when you do take a break, you do some stretches. You stretch your back, you stretch your legs, you know, you stretch your ankles, your feet and all that before you come back. And it's important that you do your exercise before you leave the house, right? It doesn't have to be time consuming, right? Your work involves probably sitting for long or standing for long. You need a very good back to be able to withstand that, right? Even if you take breaks every 2 hours, right? If you add up the number of hours you spend sitting or in stand, you realize that it's actually much. By the time you get home, you're sleeping, right? So it's important to do your exercises at home, like back strengthening exercises to stabilize your back, and then you do some walks as well. Then at work, instead of probably taking the elevator or using the cab, try and, take the stairs. If there's no
always,
stairs,
anyways,
trek.
once in a while.
Trek and walk. Just keep yourself active and keep moving. It's very important. So that there's something I say to people, like, what's the point of working for so long, as in long years, and then you retire into life of pain and all that, just because you're like, you've used yourself like a workaholic and all that. So health is very, very important. So you learn to take frequent breaks of work. You pay deliberate attention to the quantity of fluid that you take. It's easy to say I drink water, but by the time you pay deliberate attention, you may realize that probably you're taking just 1 bottle in a day, right? So, but then when you pay deliberate attention to it, you're able to measure, and then you're able to work on it and increase your fluid as well, and then walk about. Move, just keep moving, no matter what it is. And your brain will function well with exercise because it releases a lot of endorphins, which are good hormones for the body. So you are more productive because your brain works better when you are active.
Well, thank you very much, physiotherapist Ramat, for taking our time to be here with us on health and well-being.
Thank you.
And for letting us drill you on all the so many exercises that we can do to actually help us stay fit. We hope that next time when we call, you would still take out time to be here with us. Thank you very much.
Thank you.
Well, that's how far we can go on health and well-being today. We've been here with physiotherapist Ramat Ibrahim, who is the clinical director of My Physio and I Clinics. Well, that's how much we can take, but do remember that for you to feel better, you have to move better, move a lot, and you will be better. Keep it to date with us. Same time next week. I am Lois Appasambo. Do stay safe.